Bridge and wall are made with the same material, that is, bricks, but the bridge joins the people and the wall divides the people. So choose the right one. The bricks are for two different purpose, to join the people and to just divide the people. Now, different kinds of the urticaria are aquagenic urticaria, as the name is with water, so it is water induced urticaria, rare, but when seen, when skin comes into contact with water, whether hot, cold, or in between, it appears within 1 to 15 minutes of the contact with water and last 10 minutes to 2 hours. Not stimulated by the histamine discharge, most believe it is actually the skin sensitivity to the additives in the water, such as the chlorine. It is diagnosed by dabbing tap water and distilled water to the skin and observing the gradual response. Antihistamines before contact with water are the standard treatment for this aquagenic urticaria. So here one can see that one comes in contact with water and this kind of the urticaria is seen, the area where there is contact with water, and also here one can see the back and the other part of the lady that when come in contact is going to cause the urticaria, aquagenic urticaria. The next type is chronic idiopathic urticaria. It is a long-lasting urticaria with unknown cause. Word idiopathic is wrong. Better one should use the word cryptogenic, means the hidden cause. The cause is not known. Itching makes the people miserable. Few patients have antibodies to their own allergy producing antibodies. It's very rare phenomena. Some have antibodies to the histamine producing cells, that is the mast cells. So these cells release the histamine and other chemicals producing urticaria. Treatment is to remove the antibodies. So here one can see the chronic urticaria picture, that is here on the abdomen and on the chest wall, and that is the chronic idiopathic urticaria. The next urticaria is cold urticaria. It is caused by the exposure of the skin to extreme cold, damp, and windy conditions. It occurs in two forms. Number one, the rare form is hereditary. Hereditary becomes evident, hives all over the body 9 to 18 hours after the exposure to the cold. The other form is the common form. There is rapid onset of the hives on the face, neck, or hands after exposure to the cold. Test this urticaria by placing an ice cube on the skin for a few minutes. If positive, a wheal hive will appear and the skin becomes warm enough to react. Ice cube test is also used to check whether treatment is working or not. Odd is, and reverse of this is that because cooling the skin, for example, by taking a cool bath makes the urticaria better, but in the different people, this cold water can cause the cold urticaria. So here one can see the cold urticaria, that is on the back of the chest, on the arm, and here also on the back of the chest. And these are the area, this is the area of leg, that is all having these urticaria on the body because of the exposure to cold. Mostly seen in the young adults between 18 to 25 years old, severe reaction can occur with exposure to the cold water, swimming in the cold water, or in case of the water sports. There is massive discharge of the histamine causing hypotension, fainting, shock, and even death. So, while going for that cold water, take the good antihistamine and always wear a life jacket. It is seen in cryoglobulinemia, cryofibrinogenemia, or syphilis, confirmed by the blood test, show cryoglobulin, cryofibrinogen, and cold agglutinin in their blood. Treatment is not regular antihistamine, but only cyproheptadine is useful, and sometimes tricyclic antidepressants, doxepin is effective to block the histamine. Ketotifen, which is said to be the mast cell stabilizer, is also useful. Now, next type is pressure or delayed pressure urticaria after a pressure stimulus or sustained pressure enforced on the skin. Hives only appear after 6 hours from the initial application of pressure to the skin. The source of the pressure on skin are tight fitted clothing, belts, clothing with the tough straps, seen in people, those who are carrying heavy items over their shoulder, of feet of the people who stand a lot. Hands, trunk, abdomen, buttocks, legs, and the face are affected. This appear similar to the dermatographism, although called urticaria. Macroscopic and microscopic appearance is quite different. Antihistamines are failure, steroid at the high doses, and avoiding pressure and apply the sulfasalazine are the remedies for that. So here one can see one is putting pressure and the person with a long standing on foot. These are all having this kind of urticaria because of the pressure applied on here. And also the belts, the straps, and tight straps can also cause the urticaria of this kind. The next type is cholinergic or stress urticaria, that is called abbreviated as CU. One of the physical urticaria seen during sweating events such as the exercise, staying in a heated environment, or emotional stress. Hives produced are smaller than the classical hives, tiny lumps, 2 to 4 millimeter diameter, seen all over the body. It is called cholinergic because these rash can be produced by the injection of acetylcholine given to a person and having the similar kind of the rash appearing. Examine for other signs of cholinergic stimulation, including lacrimation, salivation, and the diarrhea. It's very difficult to treat this kind of urticaria. And here one can see the cholinergic urticaria and also the cholinergic urticaria on the back of the chest. Now, the next is solar urticaria. All urticaria is made worse by heat, but if urticaria occurs only when the sunlight falls on the skin. It is called solar urticaria. It is rare and being confused with the rash called polymorphous light eruptions. Here one can get rash on the wheels in hours and takes days to disappear. It is of different kind and the choice of the sunscreen creams differs for the different kind of the rays which are falling on the body. Either with the titanium oxide or the zinc oxide are being used, one can prevent if one is behind the glass. So here one can see the unusual condition caused by the exposure to the ultraviolet light or the ultraviolet irradiation. So here again one can see the solar urticaria, and here when the sun is falling on this area, that is also going to cause solar urticaria. And polymorphous light eruption, which do confuse this solar, yeah, it is an itchy and burning rash appears after exposure to the sunlight, and this is polymorphous light eruption. Then contact dermatitis, it is allergies when something touches the skin of someone. Babies with the milk allergy get around mouth where the milk touches them. Nurses and the health workers working with the latex rubber gloves, and when they come in contact, they are going to cause urticaria. Get the contact urticaria on their hands and the wrist where they touch their skin. The next type of urticaria is vasculitic urticaria, or it is also called hypocomplementamic urticaria. Here, each lump, wheal, or hive stays in same place for 24 hours. When lump has gone, it leaves a bruise mark or pigmented stain on the skin. Rash is painful or burning. Blood tests show lower complement level than normal. Test for the autoimmune disease, particularly systemic lupus erythematosus, and it is diagnosed by the skin biopsy and respond to the methotrexate, colchicine, dapsone, and indomethacin rather than the antihistamine. So here one can see urticarial vasculitis. It is a type of cutaneous vasculitis indicated by the inflammation of the walls of the small blood vessel. So here again one can see the picture of vasculitis. It is a beautiful island, and it is really the work done by someone so intelligently to make an island within the sea. It is just a human effort beyond praise, and one can just look and see that what can be done if someone is willing to do anything. Now, the next is urticaria by stress. Emotional stress, psychological stress is aggravating factor for the urticaria. People with the asthma or the urticaria get their symptom worse when stressed. Stress can increase number of severity of the wheals by increased scratching. Stress is not a true cause of urticaria, but, but urticaria is the real cause of the stress. So relief of stress cause less notice of the physical symptom. No evidence that urticaria is more common in the mental hospitals. Many antidepressants are very effective, antihistamine too, so these are used to treat this urticaria by stress. So here one can see the stress rash and also the stress rash, and the person who is in stress do like this and causing the rash because of the stress. The next is Urticaria pigmentosa. It is a familial dermatologic disorder characterized by hyperpigmented yellow, tan, or brown papules or the plaques associated with urticaria. There is lymphoproliferative disorder also. These lesions are composed of the mast cells. When skin underlying an individual lesion of urticaria pigmentosa is stoked, a linear wheel is formed. This character and the diagnostic sign is known as the Darrier sign, which is the diagnostic for urticaria pigmentosa. So here one can see the pigmented lesion, and also here in the child the pigmented lesion and the Darrier sign, that is gentle rubbing or stroking of the lesion. They are causing the local itching, erythema, and the wheal formation within 2 to 5 minutes due to the release of the histamine. It is seen also in cutaneous mastocytosis, juvenile xanthogranuloma, leukemia cutis, and histiocytosis X, and lymphoma. There is one pseudo Darrier sign which is seen in the smooth muscle hematoma. So one have to consider the true Darrier sign. The next type is exercise urticaria, abbreviated as EU. People experience hives, itchiness, shortness of breath, and low blood pressure 5 to 30 minutes after beginning the exercise, can progress to the shock, and even the sudden death cases have been seen. Seen after jogging, or if one exercises within 30 minutes of eating particular foods like wheat or shellfish. Exercise urticaria is diagnosed by having patient exercise and observing the symptoms. Immediate symptoms are treated with antihistamine, epinephrine, and airway support to save the life of the person. Taking antihistamine or ketotifen mast cell stabilizer prior to the exercise is also very effective. So here one can see the urticaria because of this exercise on these areas, the chest, abdomen, that. Now, next is dermatographism or dermatographic urticaria. It is also called skin writing, seen in 4 to 5% of the population. A physical urticaria where wheals and the hives form after firmly stroking or scratching the skin. Here, skin becomes raised and inflamed when stroked, scratched, rubbed, or even slapped. Cause is unknown, may be preceded by a viral infection, antibiotic therapy, or emotional upset. It is diagnosed by taking a tongue blade and drying it over skin of arm and back. The hives develop within a few minutes, disappeared within 30 minutes. Treatment not needed, antihistamine can help sometime. So here one can see the skin writing, and just you draw anything and there will be the lines which are seen as this kind of urticaria. Creation by some artist, the woman and the hand on this near water bank. It's really beautiful, and imagine the effort of the person who have made it. Now, coming to the diagnosis of the urticaria, it is based on the appearance history to find the possible cause of the hives or angioedema. Patch testing may be useful to determine the allergy. Lab studies are not much helpful and not indicated. Imaging studies are also not indicated. But the routine blood test to determine any systemic illness causing allergy or the urticaria. There are higher IgE basal level in the blood, higher CRP levels, higher AST levels, higher anti-TPO level, and the higher level of the cytokines like IL-17, IL-31, and IL-33 in the blood. So the most common is the medical questionnaire, physical examination of the patient, and if needed, one can go for the allergy test, autoimmune disease test in the blood, test for the infection, and skin biopsy as the part of the urticaria diagnosis. The skin allergy test, we can use the different allergen like cat, like dog, like feather, pollen, and other common things with which the person is exposed in daily life and to see the reaction of that allergen on that person. Now, the differential diagnosis of the urticaria is eczema, acne, contact dermatitis, occupational dermatitis, neurodermatitis, poison ivy rash, and prickly heat. One can see the eczema picture, and here there is acne, and there is a contact dermatitis with contact with some allergen, and occupational dermatitis, the person in some occupation with contact with some allergen all the time. And here one can see the neurodermatitis picture and also the poison ivy rash which is seen after some insect bite. Now, coming to the treatment of the urticaria, the medical treatment of the urticaria part 1 is timely hospitalization for life-threatening allergic reaction like urticaria, angioedema, anaphylactic shock, or the bronchospasm which occurs as the severe urticaria. So use subcutaneous epinephrine or the nebulize with albuterol to release the bronchospasm and save the life of the patient. Give intravenous fluid if the patient is hypotensive and give oxygen also as the life-saving procedure. Now, the latest treatment guideline of urticaria are that in step 1, use second generation H1 receptor blocking antihistamine like diphenhydramine and hydroxyzine. These are second generation. The first generation are chlorpheniramine and other. Hydroxyzine is better than diphenhydramine, and one can also use H2 receptor blockers, antihistamine, which are cimetidine, famotidine, and ranitidine, being used for the gastric ulcer, but also as H2 receptor blocker antihistamine. Now, step 1 continuing medical treatment. H1 and H2 antihistamine have a synergistic effect, so rapid and clean and complete resolution than H1 antihistamine alone. For severe diseases, systemic glucocorticoids can also be given. Now, step 2, increase the dose of the current antihistamine, add other antihistamine or add a leukotriene receptor antagonists such as the montelukast stabilize the mast cell membrane and inhibit the further antihistamine release when we are going to use this treatment in step 2. Now, step 3, add or replacing the current treatment with hydroxyzine or doxepin. Doxepin is a tricyclic antidepressant with potent antihistamine properties and being used for the cases which are non-responding to the other antihistamine or the refractory urticaria. Now, step 3, the medical treatment of the urticaria is take the doxepin at the bedtime because of the sedative properties. If no response, it is said refractory symptom. Topical therapy with 5% doxepin cream or capsaicin useful in refractory cases. Anti-inflammatory medication, dapsone, sulfasalazine, opioid antagonist like naltrexone are also being used. Immunosuppressant, cyclosporin, sirolimus, or omalizumab, and afamelanotide are also used sometimes. Chronic urticaria respond to doxepin. ACE inhibitor induced angioedema not respond to epinephrine because it is not an IgA mediated. Cyproheptadine useful in recurrent cold urticaria. Now, what is the prevention of urticaria? Prevention is by avoiding the triggers, avoiding of the further exposure to the antigen responsible for urticaria and the keeping the environmental temperature cool is also useful. Now, there is one pseudo urticaria, so beware of that pseudo urticaria from the true acute urticaria. In pseudo urticaria, there is maculopapular exanthems, that is because of the viral or drug rashes, urticaria-like dermatitis, as one can see in nubular eczema, erythema multiforme, insect bite reactions, that is papular urticarial, lymphocytoclastic vasculitis, leukocytoclastic vasculitis, then polymorphic light eruption. I have already told you something about that, and rarely lymphoma cutis, including cutaneous T-cell lymphoma, and some autoinflammatory syndromes are responsible for causing pseudo urticaria. But in case of acute urticaria, there is viral infection, particularly in children, in adults, prodrome of hepatitis B, infectious mononucleosis, Epstein-Barr virus, hepatitis C virus, active infection, drugs like non-steroidal anti-inflammatory drugs, then penicillin derivatives, sulfa drugs, anticonvulsant drugs, and radiocontrast media used for imaging, foods non-allergic like scombroid, fish poisoning, and allergic are the IgE mediated like nuts and shellfish. So these are the food responsible for acute urticaria. Then immunization vaccine, measles, mumps, and rubella, tetanus toxoid, and then this immediate contactants are causing the acute urticaria. So that is end of the urticaria. I have given as much as best possible description and the knowledge of urticaria, and I hope you may like it. If you like it, please subscribe my channel. And if any question, you can call to me and you can ask any. And thank you very much. That is the end of the lecture. And I am thankful to you for to be with me and enjoying the lecture. Thank you.